Welcome to the AUA News Inside Track podcast, an official podcast of the American Urological Association. Thanks for listening. For more episodes of this podcast, visit www.auanet.org/podcast.
Welcome to the podcast. My name is Karen Johnson, and I am AUA's Director of Quality and Measurement. Today, we'll hear from Drs. David Penson and Matthew Nielsen, who will provide a brief overview of AUA's National Quality Agenda and Strategies for Urologic Practice and discuss its significance for AUA and for the field more broadly. Dr. Penson, Dr. Nielsen, thank you for taking the time to talk with me today. Before we delve into this topic, will you introduce yourselves and tell our listeners a little bit about your clinical interests and your roles at the AUA?
Matt Nielsen, I'm a urologic oncologist and health services researcher at UNC Chapel Hill, and I serve AUA as the chair of the Science and Quality Council.
That was short. You could go on for hours if you wanted to.
I'm just a simple country doctor from a small.
Well, I'm Dave Penson, and I'm from the federal government. I'm here to help. Isn't that the line? I'm Dave Penson. I'm AUA secretary, and just like you, I'm a urologic oncologist and have a track record in health services research. Do less of it now, a lot more administrative stuff, but I've always had a real interest in quality improvement and patient safety. And as I know you have, Matt, and I'm really excited to talk about this because I think this is kind of where we're going, and I think that's a good thing.
Great. Thank you guys so much. So, Dr. Nielsen, let's start with you. And Dr. Penson, jump in however and whenever you'd like. So our quality agenda, I'm not going to use that long title. I'm just going to call it the quality agenda. It articulates 6 priorities and 4 strategies that we want to use as kind of a guidepost for quality activities over the next decade. So can you start us off just by introducing those priorities and strategies, and maybe if you can talk a little bit about how those kind of rose to the top of importance to get into this quality agenda?
Sure. Thanks, Karen. Well, thanks in large part to your leadership as our director of quality, and also input from a lot of other folks on the AUA team and our volunteer committee members and committee chairs. We had some really great discussions. We were, sort of at a point where it was kind of timely for us to be thinking about a roadmap going forward. We've built up a lot of great activities over the years. I had big shoes to fill following Dr. Penson. He was the Science and Quality Council chair before me, and then Dr. Wolf before him. But for members who aren't familiar, the Science and Quality Council brings together activities across our quality improvement, patient safety, data, and guidelines committees, and really tries to coordinate those activities. And really, I think a thoughtful structure, a great legacy and sort of foundation built up by Drs. Wolf and Dr. Penson. And so we were at a point to say, where are we now? Where do we want to be in the next 5 or 10 years? And it coincided in time with some new standards from the American Board of Medical Specialties for all the certifying boards, and our member board, the ABU, the American Board of Urology, sort of also having some interest in mapping out a quality agenda. And so we're really fortunate at AUA and within the field of urology to have a really great collegial, collaborative working relationship with our ABU leaders. And so in conversation with them and with folks in our group, spent some time, pulling this together. And it was a great, sort of brainstorming and strategic planning exercise. And I think, as is often the case with strategic planning work, it kind of helps us think through but the work that we've already done and what is laid out ahead. So with that background, the 6 priorities that were identified are addressing health disparities and promoting equitable care in urology, improving patient safety, enhancing diagnostic excellence, promoting person-centered care, promoting value in urologic care, and promoting joy in work. And I think as we start to think about those broad areas, they're all very interrelated. They already touch on a lot of spaces that, we have spent time at AUA and, our members have spent time in their sort of practices locally working on for years now, but really trying to lay them out and articulate those as priorities that are interrelated that we want to really try to help support our members' work in. Across those priority areas, we also articulated 4 different strategies that, again, sort of touch on the different priority areas. And these describe more the how and the what of what we'll be doing in terms of the approaches AUA will use to address those priorities. And those included systematically assessing quality concerns in urology, promoting the science and practice of quality improvement, integrating and aligning quality within the specialty at large, and collaborating with the community of folks involved in patient care for patients with urologic conditions, including those within the specialty, but also those adjacent to the specialty, primary care, emergency medicine, radiology, the patient's families also, but really trying to think more holistically about that community that's around the patient navigating through that care journey, and how can we develop activities that support them through that.
Yeah, I just add, just because I can, because you know me, I'm never at a loss for words, right? But I'm really excited about what you guys have done here, and the reason is just from a historic perspective. I think if you look at what urologists want to do, what clinicians want to do, right? We want to provide the highest quality care. We want to do the right thing by our patients. But sometimes I feel like we've been a little bit at sea when it comes to quality improvement, maybe across all of medicine, but certainly through urology. And if you look at the history of the KIPS committee and in AUA, I mean, we're always, so how can we measure quality? What do we do there? What do we, and the nice thing about this agenda to me is that it actually sort of lays out sort of a nice ground, a nice blueprint beyond let's just measure some outcomes, right? Or some, processes. Let's now say, okay, well, what do we really want to do here? And so I think you've done a nice job with that. And I think it really resonates with me. Just to add to that, it gets us away from this historical sort of, well, let's talk about quality measures. And now we're talking about more long things, how do we, improve care? How do we make it more equitable? How do we improve value in care? So I really like that. It's very different than where we've been before. And I think it's important for, AUA members and frankly, patients too, to recognize that this is important and that we're committed to this.
Yeah, thanks, Dave. And again, big thanks to Karen Johnson, our director of quality, who is a really great leader, kind of corralling all of us urologists on this work. And we really were very intentional in the process of trying to develop it into something that was not an overwhelming 1,000-page document for people to read through, but pretty high level to try to walk through the thought processes that are helping to guide our work. So for members who haven't had a chance to check it out, we'd encourage you. It's available on the AUA website. There's some other summaries of it available in different AUA publications, AUA News and elsewhere, where we're just trying to sort of put that out there. And like all things we do, we really are here for our members and the patients who they serve, and so we welcome feedback and are excited to get more engagement from folks as we try to start executing on that plan.
So, Dr. Penson, you kind of alluded to this already a little bit, but I'll just ask you very specifically. This agenda required approval by various governing bodies within the AUA, including the board of directors, of which you are part. And I know it's been a while since the agenda was approved, but do you recall any specific areas of concern, or have you heard areas of concern since we've sort of unveiled it? And then kind of from your perspective as a practicing urologist, just any other reactions that you have to the agenda?
Yeah, I have to tell you, this was not a controversial discussion at the board level. And part of it was because it couldn't be. And what I mean by that is, we are partnering with the American Board of Urology on this. It is coming down from the ABMS that they want specialties to set these quality agenda. And so, in that regard, it wasn't like this was an optional thing to do. I mean, AUA could have said to the board, you're on your own, but that's not how AUA works. And what I mean by that is that, again, I think integral to the fabric of the American Urological Association is doing the right thing by the patient, right? And I think this is doing the right thing by the patient. So this was not a particularly controversial agenda. I'll say that. Yeah, there are questions about how do we interact with the board on this? How do we address concerns from our members? But again, I don't think if you look at the points in the agenda, people aren't going to argue about, okay, well, let's try to, improve equity for all patients with urologic conditions. And it's not like the political discussions going on right now. It's, how do we make sure people who have a urologic problem get care, and how do we, promote value? Because, these are not things that there was a lot of argument about. I think, one of the things that's interesting is, and I noticed this, is that, the priorities aren't numbered. And I think that's a good thing, because I can tell you, if we talk right now, if you said to Karen, if you weighed in, what do you think is the most important thing? And Matt, you weighed in and I weighed in, I'm willing to bet there'd be at least two and probably three different number one priorities, right? And in the end, that doesn't necessarily mean they're all equally important, but they're all relevant. So I do like that point. It's going to be interesting to see how this plays out, because we are, when you look at this from a board perspective, the American Board of Urology, and when I say board, I mean the AUA Board of Directors, I should be very clear because we keep using the word board. From the BOD's perspective, ABU is an integral partner for us in this, right? So how does that interaction work? Luckily, ABU and AUA have a long track record of working together and working together well. Very short answer made long. There weren't a lot of concerns, because this is a very laudable goal, and the agenda sets out these 6 priorities, all of which are important. So the board, embraced this.
Well, that's good to hear. I wasn't at those discussions, so that was good. So, Dr. Nielsen, it's probably pretty easy for folks to think about applying the quality agenda from the work that I do at the AUA, the quality and measurement side. So let's start there, and maybe just give a couple of examples of things that you know of that we're working on that kind of align with this agenda.
Yeah, I think it's a great question, Karen. So the Quality Improvement Patient Safety Committee, I had the pleasure and privilege of serving on that as chair and as a committee member before my current role. And so it's a space that, we're really proud of a lot of the work that's been done there. One example is that, we've marched out a series of quality improvement summits over the years that have I think they're a good example of where some of the things that we have explicitly articulated in the quality agenda are actually describing things that we've been doing for a while and want to kind of reinforce and double down on it. And that idea of kind of collaborating across specialties as an example. So we have had a lot of successful quality improvement summits around prostate biopsy complications, bringing in infectious disease experts, radiology stewardship, bringing in, radiology experts and emergency medicine physicians, and shared decision making and other topics over the years. And so this year we convened a quality improvement summit that, again, kind of stuck with that theme that we are proud of and are committed to, of collaborating with all the players across the patient's care journey, and had also brought in one of the themes from the quality agenda of diagnostic excellence. So that's been a space that we've been doing a lot of work in that area for a while, but it was kind of recognizing and appreciating the broader landscape of the National Academy of Medicine report in 2015 about diagnostic error in medicine. Great work led by Helen Burston on the Council of Medical Specialty Societies, bringing together our societies across different disciplines to appreciate that diagnostic excellence is what we're after. And that most recent QI summit was with radiology colleagues, understanding how we can improve the quality of the MRIs that we as urologists then use for the MRI targeted biopsies for prostate cancer diagnosis, and then also how we can spread and scale regional efforts that have been used to improve the fusion biopsy component. So that work that we've been doing in our field, our radiology colleagues have been doing in their field, was a really great opportunity for us to knit together a couple of the themes from the quality agenda that was relevant. The other elements that we've been working on, and I say we, the row, we, you especially, but the whole team of shepherding and maintaining the quality measures that we have in Aqua. We are fortunate and lucky to have a lot of urology specific quality measures. And so that work continues moving on. There's been a great work group with a lot of experts in the area focusing on, trying to start mapping out a strategy for how we could develop measure concepts that get at our goal of health equity or health for all in the space of urologic conditions. And so I think that's another example, but we could talk about that for a long time.
I actually think you're selling yourself short, which you shouldn't, Matt. because I think it's more than just the summit and the quality measurement. What you've done with this agenda, in my opinion, is you've tied together certainly all the activities within the division of S&Q, because they all support this agenda when you stop to think about it, right? You've got your summits, you've got your measures, but you have Aqua, which is an important, tool to push quality improvement, which, really matured as under your leadership as S&Q chair. And even maybe not even, I shouldn't put it that way, but just as importantly, the things that we're doing in guidelines and the changes that have been made and that are coming will support this even more. So I'm not taking away from the QI Summit piece or the measurement piece, but I'm giving you more credit than you're willing to take, and say that this is, there's a lot going on in this space that's going to support this agenda, which I think is terrific. And it goes across more than just S&Q, by the way. It goes across the entire organization, the specialty, but it starts in S&Q. So credit to you guys.
Yeah, thanks, David. And I think, another area that we, sort of called out in the quality agenda, and it was really channeling, conversations that have been happening in the committees over the last several years, were acknowledging that, for those of us who have the pleasure of, working with the future generation of urologists, that, the physicians coming through medical school and residency training now, I mean, they eat and breathe and speak QI, very fluently. Whereas, the quality improvement language and principles and sort of playbook were things that were not as familiar to some of us with a few more gray hairs or less hair in general.
Thank you, Matthew.
Well, just wanting to be inclusive. So, so I think we're really lucky in our specialty to have people who are just really lights out, spectacular, teachers, leaders, sort of leading by example in that space, both with learners in a, formal educational setting, but also in their practices. And so, one of the other areas that is, something that we've kind of talked about for a while, but, now are really starting to deliver on, is laying out more of a playbook for, I think, fundamentally, like you said, Dave, everybody's North Star is doing the best for their patient, and everyone wants to do better, wants to know how to improve their care. And sometimes it's just sort of hard to know, what are the behaviors, what are the sort of strategies and tactics that work well for others? What are the ways for us to kind of, visualize this in our practice or our department or what have you? And so that's a new effort that we're really hopeful is going to be useful for folks. And then, finally, that theme of joy and work. We've spent a lot of time, as a specialty and as a profession, acknowledging and, sort of talking about the burnout epidemic, which is definitely a thing in our profession, but it's larger in society at whole. But the work that we get to do is a real privilege, and being able to improve the care of the patients that we are taking care of is a really rewarding thing that we're hopeful is going to be a helpful balm for that as well.
I have to say, when I saw the joy of work thing, it doesn't resonate with me as much, only because, and I know it should, but like, you read all these things like, oh, urology is the specialty with the most burnout. And I kind of don't believe that. I think there's burnout across the entire field. And one year it's urology, next year it's a different specialty. But the fact of the matter is, I in the end, when I saw that first thought, I thought that was kind of an odd priority. And then I realized y'all are right. Because if the clinicians themselves are miserable and hate their jobs, they're not going to do a good job taking care of sick folk. And so, credit to you. Although I just want to give pushback. I do not think urology is the most burnt out field in all of this. Some people say, I hate when I see that, because we're all a little burnt out, but I know a lot of people a lot more burnt out than me in other specialties. So anyways,
But a pretty great job.
Yeah, I can't complain.
Mm-hmm. So you guys have already, I think, probably touched on this, but I'm going to ask you the question anyway. Kind of a two-parter. I'll give it to both of you. So, one of the things that AUA's board of directors has done is they've actually included implementation of this quality agenda as one of its strategic goals. And to me, I think that's a big deal. So I'm hoping you could talk a little bit about, why that's a big deal, why they did that, what you see as its potential impact. And then maybe give some examples of, we've heard about the great things that, the S&Q division is doing and the, our quality and measurement team is doing. But I think having this as a strategic goal for the organization means that everybody at the AUA is working to implement this quality agenda. So what does that mean? And can you give some examples of
Yeah,
how
yeah.
you see that happen?
I can start, and Matt, you can chime in. Uh, one of the things I like about AUA, and there's a lot I like about the American Urological Association, but we're very um, fairly transparent. I mean, we lay out goals every year. You have, for the organization, for the leaders of the organization, and we assess our progress. And so to be at the very top of the list, say this is a strategic goal for the organization. I mean, that says a few things, right? First, it says that this is like, you know, really important. It cuts across the entire organization, not just S&Q, but other divisions. And it's going to be a priority for us, you know, and it should be, right? Because it goes back to, we want to do the right thing by our patients. That's in our mission statement, right? Not in those words. That's Penson paraphrasing. But that being said, so I think that's the first thing, Karen, is you have to acknowledge that to put it in, the board's, list of key priorities for the organization, that tells you what we're thinking about this and what the board wants to see the organization do and wants to see what the specialty does. Now, if you're going to do that, right, it can't just be an S&Q. And if you look in other areas of the AUA, and AUA is, I've come to know very well after all these years. It's a huge organization with a lot of moving parts. And, look in some of the other areas where this is going to touch. It's going to touch in public policy, right? Because you have issues around coding and reimbursement, around legislation, regulation that are going to tie to quality. I mean, we know that Medicare wants to tie reimbursement to quality improvement, right? And quality outcomes. Well, it's not S&Q that interfaces with Medicare. It's public policy and the people in that group. I think you're going to see this agenda driving our advocacy groups and our regulatory and compliance staff, trying to move this front and center to what we're advocating for in DC, in Baltimore, at Medicare. So that's one place where I think you're going to see this. The other place I think you're going to see this a lot in the organization is through the Office of Education, right? So how do we help our members to get better? How do we help our members to be better clinicians? And, that's through the Office of Education, through courses, through lectures, through the annual meeting. And I think you're going to see this more front and center in those venues. And I'll add, I mean, we talk about, other urology adjacent or relevant stakeholders, call it what you will. I mean, it's not just urologic physicians, it's urologic APPs who are full members of who are members of our organization now, full members for that matter. Whether it's other specialties, people will leverage our resources in the Office of Education as well to, improve quality, and they'll be driven by what's on this agenda. So, to me, I think that's where you see this alignment within the organization, and it comes from the board setting it as a key strategic priority.
Yeah, I think that was really well said. I also would say, just as we are engaging with, colleagues that are connected to the care of our patients across other areas, this exercise of going through and laying this out really helped us articulate, honestly, a lot of things that we were already doing, but, kind of seeing it through the eyes of, this is actually the longer term vision we're on. And, there's a lot of things that have been just in the fabric of the work that S&Q and AUA has been doing of, really, really, continuously improving the guidelines, making them very risk stratified, very patient centered. That's something that, it really resonates with a lot of our colleagues within the sort of other medical specialties. And when we can sort of articulate that and bring forward examples like, the new hematuria guideline, the new AUA early detection of prostate cancer guideline, and, talk about some of that work through the lenses of health equity, of, person-centered care, of diagnostic excellence and high value care. It's not, in many ways, it's not this radical transformation of what we are doing and, where we're going, but it's helping us sort of see those in a perspective that then can help us understand what our next step should be.
Perfect segue. So dust off your crystal ball. What are the next steps? Anything big, 5-10 years down the road after we've implemented this for a while?
Yeah, well, I think we're just really lucky to have such phenomenal staff, including but not limited to you, Karen. The staff at AUA, and if you haven't had a chance to work as closely with the AUA as Dave and I have, you might not have had a chance to really appreciate it. But the staff who work at AUA are just absolutely spectacular and absolutely committed to this work. And so I think working with the staff, working with the physician leaders at all levels, one of the things that we've again sort of appreciating across the different areas of AUA, our colleagues in public policy and the Public Policy Council have been really, really inspiring to all of us in bringing in the next generation of leaders, of people in training and early career folks, and we're really engaged in that work also with our current S&Q fellow Max Bowman from UCSF, of really trying to understand what are the other good ideas that people bring when there's this sort of rough outline sketch. How can we bring the best ideas of the people who will be doing this work when Dave and I are retired in the hopefully not too distant future, but it will happen. And so I think we're really excited to now that we have this out there to really get input and advice and sort of inspiration from people who have their own great ideas. And I think as one of the things that I love about this organization is how inclusive it is and how eager AUA is to get that kind of input.
Yeah, I mean, what can you add to that? I think you're spot on with everything you said. Karen, you asked about a crystal ball. I don't know about crystal balls, but what I do know is, we're going to do a lot of experiments based on this. That's the best way to think of it. Little things, big things, and they're not all going to work, by the way. But that's why I don't really want to sort of hypothesize about what it's going to look like in 10 years. But what I see is an excitement on a lot of people's part, and as Matt alluded to, people with younger, more hair than I have, that's for sure, who are really committed to this. And I think what we're going to find over time is that ideas which are percolating around now, while they're not all going to work, things like changing the way we do guidelines, getting them out quicker, so we have better definition of what quality care is. Maybe it'll be application of health information technologies in a way that doesn't make our burnout worse, but actually helps us to do our job and improve the quality of care. There's so many ways this can go. So it's an exciting time. And, I think, like we've said all along, the organization is committed to this because it's going to take some resources, but I think AUA is ready to commit resources to do this right.
That's fantastic. So this has been wonderful. Thank you so much for talking to me about this today and to, providing this kind of, backdrop for the audience to know a little bit more about our agenda. Any last words before we sign off?
Matt, you get the last words. This is really, you're doing more than mine. So.
Oh yeah, well, anytime that Penson lets somebody else speak, you gotta sort of. I'm kidding. I kid because I love. No, but it really is. I think we're really excited by this. We're really grateful for I think a sort of uniquely constructive, positive relationship with our certifying board. And this project is the latest in many examples of that. And think both certainly within the Science and Quality Council, but really across the AUA, of ways that we can knit all of this into the fabric of what we're doing. And so we just encourage anyone who's interested to reach out and share their good ideas and raise your hand to come and join the fun.
Thank you so much, Dr. Nielsen, Dr. Penson, and thank you for listening to this podcast. You can find the quality agenda on our website. And if you would like more information about how we're implementing the quality agenda, or if you have ideas for us to think about, or if you want to help us implement, please reach out and let us know. You can contact us at quality@auanet.org. Thank you very much.
This has been an AUA News Inside Track podcast. Thanks for listening. For more episodes of this podcast, visit www.auanet.org. auanet.org/podcast.